Always a pleasure to have with us here at ASCO is Dr. Robert Andtbacka from the Huntsman Cancer Institute in Utah. Thank you for stopping by again, sir. I know it's a busy conference for you.
It's been a very busy conference, but it's been a very interesting conference for us. So we have presented a large number of new data on multiple products, and one of them being talimogene laherparepvec. And to refresh our memory where we were last year when we sat here, we presented data on the OPTiM study. Now, OPTiM study is in patients with stage 3B, 3C, and stage 4 melanoma. And this was a randomized phase 3 study in patients with injectable lesions. These are either dermal, subcutaneous, or lymph node lesions. And in this study, patients underwent a randomization in a 2-to-1 fashion to receive either talimogene laherparepvec. Now, talimogene laherparepvec is it's an investigational product. It's a herpes simplex virus that is injected into the tumors, is taken up by tumor cells, and activates the immune system to fight the melanoma, not only in the injected area, but also at distant sites. And in the OPTiM study, patients were randomized to either receive talimogene laherparepvec or GM-CSF, which was administered subcutaneously. And last year what we presented was the primary endpoint of the study, which is durable response rate, defined as a response that was initiated anywhere from initiation of treatment within the first 12 months. But it had to be per modified WHO criteria, last for at least 6 months. So fairly stringent criteria. And what we found was that talimogene laherparepvec was substantially superior compared to GM-CSF. We also presented last year data on an interim analysis on the overall survival. And this year we're presenting the primary evaluation of that overall survival. It's a secondary endpoint. And what we found was that patients treated with talimogene laherparepvec compared to GM-CSF had a substantial increase in survival, with a median increase of 4.4 months in the talimogene laherparepvec group compared to GM-CSF. The hazard ratio was 0.79 and the p-value was 0.051. So this was very exciting for us to show this clinically important difference in survival for these patients.
So overall, you're happy about the big difference between what you're presenting this year and what you had last year, and if so, what do you think is the significance of it?
So I think the significance is that we have again looked at the safety of this. The talimogene laherparepvec is very well tolerated by patients. The grade 3 and grade 4 toxicities are uncommon, happen in less than 3% of all patients. Also, what we have been looking at is asking the question and using this as a monotherapy and in combination, similar to most other agents that we're using right now. We always ask, can we use this in combination? So I think that there are patients who will benefit from this as monotherapy, but also I think there are many patients who will benefit potentially from this in combination therapy. And one of the studies that we presented here as well is using talimogene laherparepvec in combination with ipilimumab, which is an anti-CTLA-4 antibody. And what we found there was that there was really no added adverse event or toxicity in using this in combination. We also, for the first time, looked at the response rates for this, and this was very encouraging. We found a response rate of 56% in patients receiving this combination, which is greater than we would expect to see from either agent alone, potentially. Now, again, very preliminary data in 18 patients, but encouraging. And actually, that combination study is now moving forward to a phase 2 component that's already enrolling, in which patients are randomized to receive either ipilimumab or ipilimumab plus talimogene laherparepvec. So that's data that will be available probably 1 to 2 years from now. We don't know for sure. The study is still enrolling, but again, very encouraging for us.
A lot more to look at, but looks like progress on multiple fronts.
Yes, absolutely.
Very good. Congratulations. Back to work.
Ben, thank you.
Thank you, sir. Thanks for stopping by again. Always a pleasure.
Yeah, great.